Hi, Barbara Wally here, orthopedic and sports certified physical therapist, here to talk to you about headaches. Believe it or not, there are many kinds of headaches out there. I'm going to review a few different kinds of headaches and then ultimately lead up to the kind of headache that physical therapy can help the most with. The first headache I'd like to talk about are migraines. Everybody has heard about migraines. You know somebody who suffers from migraines, but migraines are typically something that happens within the system inside the brain, and they tend to be closely intertwined with changes in hormones. So if you're going through menopause, or you are pregnant, or have recently, given birth, and you're having just changes, massive fluctuations and changes in hormones, that can trigger a migraine. Migraines tend to have like a visual aura, sensitivity to light, sensitivity to sound, because it's something that's going on inside your brain, inside your head, and inside your system. But also electrolytes, significant dehydration can cause migraines, as well as medications, and stress, like anything, can trigger a migraine. The next kind of headache I'd like to talk about are sinus headaches. Sinus headaches tend to be in our face. You'll feel it up through here because we have a large sinus up in our forehead, a large sinus behind our nose. So you'll have a sinus headache like in your cheekbones, even up into your nose, and sometimes right in your face, because those sinuses can dip down kind of low into your cheek. Those tend to be related to maybe you're sick with an upper respiratory infection or a head cold, or you've got significant allergies, things like nasal sprays, antihistamines, those kinds of things. And of course, consult with your allergist or your doctor to find out what works well for you. But those tend to be in our face, and it tends to be on both sides. It won't be just, limited to one part of our face, which leads me to the next kind of headache called a cluster headache. Cluster headaches tend to be on one side, and it tends to be around your eye, specifically right behind your eye, sometimes in the temple, but it's one-sided. These tend to be very, very significant, very, very intense, and significantly debilitating. The interesting thing about cluster headaches, they are tightly intertwined with alcohol and smoking. If you're a smoker and you get these cluster headaches, one of the best things you can do for yourself is to quit smoking. There are also such things as exertional headaches. Exertional headaches, if you are working out or pushing your body that hard and that far that you're getting a headache, you got to stop. Your body's trying to tell you something and you've got to back down. The next kind is a hypertension headache. If your blood pressure is that high, and listen, today's day and age, you can get an automated cuff and have it at home. You can check your blood pressure at the grocery store, at the local pharmacy. If you've got high blood pressure and you're not taking your medication or seeing your doctor like you should, then you've really got to get it under control, because your body's trying to tell you something that you may need to be on a drug or do something. Maybe chronic stress is causing hypertension. That's causing a change in your body and causing a headache. But lastly, I'd like to talk about headaches that are tension related. These can be highly related to stress, positioning. Maybe you sit at a desk all day and your chair is not the best, or your desk setup is not the best. Repetitive stress. Those who work in, say, a factory setting and they're constantly moving in a position, or they're constantly looking up, or constantly looking down. These can cause significant issues with headaches. Also, an injury like a car accident, whiplash, where you're hit from the side or hit from behind, or you rear end somebody, that can cause significant problems with injury to the ligaments and the muscles in your neck as well. And those are injuries and issues, just to name a few, that physical therapy can help you with. So if you're struggling with tension headaches, or you're not really sure, reach out to your healthcare provider, or make sure you see your local physical therapist. I hope you have a great day. Thank you, everybody.